We have an exciting program for you, and this is with Dr. Joe Raemaker. He is a veterinarian that specializes in research in all types of nutritional therapies and remedies for pets. Dr. Joe Raemaker.
Thank you, Joe.
Dr. Raemaker. Oh, sorry, go ahead.
Pleasure to be here.
Oh, well, it's wonderful to have you. Tell us, what inspired you to become a vet?
Well, it goes back to being raised on a farm ranch environment. I went to college, University of Nebraska, and after about a year or so, I thought, you know, why not apply this 18 years that I already have? I've been working with my father with animals from pigs to cattle to dairy cows. It just was a natural saying, why go be an engineer when you have this knowledge in animal husbandry? So it was kind of a no-brainer. And from there it was, working my way through the University of Nebraska with a bachelor's and then over to Missouri for a DVM and found the beauty of Santa Cruz, California, and no snow, and I love it.
What event in your life triggered the desire to become a holistic vet? I mean, that's cutting edge.
Thank you. I feel it's cutting edge. I'm going to correct you on the word holistic, if you don't mind.
Okay.
I would probably lean more toward naturopath. I think in my heart I'm more of a naturopath than I am holistic.
Okay.
Meaning
tell us the difference.
Holistic, to my understanding, I'm not an expert in that area, is looking at the whole of the body. In other words, the environment, everything dealing with the body. Naturopathic medicine, I look more as what comes from nature to feed the system. How do we balance the body as it is today? From the water to the soil to looking to nature for its medicinal quality, and that's really where my heart is. That's where most of my nutrition has been for the last 41 years. I've always felt that why am I so smart that I could overcome what 1 billion years of nature has evolved a plant or the minerals or the glacial deposits that are in our soil? For example, I use things like Mount Marilanite from glacial deposits. How could I create a more balanced blend of trace elements, 74 trace elements, than what nature provided? We've grown with that balance.
I believe something happened in your history that led you to go into looking to say the rainforest and different places to find cures.
Medicine man, huh? Well, there was yes, and when I was 17 years old, I went in the military, and I remember being bored, sitting out there in whatever, in bivouac or something like that. As you get in the service, sometimes you have idle moments, a lot of times you have active moments, but I grabbed a book named, I think it's called Richie Calder's Medicine and Man, and it went a great deal into what nature provided, pathways and ingredients for medicine. And to put that in perspective, many of our current day pharmaceuticals are from mushrooms. Let's think about penicillin. 1929, Fleming. It's a fungi, right? Mm-hmm. He didn't pull it out of some synthetic test tube. And that's why I always felt the answers are right in front of us. And so I've always been fascinated to say, hey, don't get too fancy with chemistry because it's right here in front of us. Just look a little more carefully. Turn every leaf.
Tell us about, I know that you've been doing a lot of research and your particular field and your products. I know you have some product line now, but the cures that you've been able to have these great successes with have been backed up with research. Could you tell us a little bit more about your research?
Research started, oh golly, I better go way back, 1971. I was fortunate enough to meet a gentleman, Dr. Enzel Stutz, Southern California. And I was really interested in preventive medicine. I hated getting up 3 o'clock in the morning treating a colic on a horse that was eating some bad moldy hay. And I thought, I don't like getting up, and I don't like to see this babysitter here with a limited budget and a horse that needs $2,000 worth of surgery and can't afford it. And I got to say, that's not fun medicine. We've all been there. I hated. I said, let's prevent this problem. So I started by making total all-in-one pellets, nicely balanced pellets, high-quality feeds, and I even held lectures at Dominican Hospital, never forget it, invited select clients, and I educated them in nutrition. I said, I don't want to treat your mistakes. I want you to have a happy hobby. I want to do preventive medicine. And that really spurred me, the satisfaction to going to a client, knowing that you've got a mare in foal, delivered a healthy foal, cow, etc. That just buzzed me, to put it bluntly. I mean, I just said, this is what I like to do. And I was hooked. So from there it evolved into, wow, doing pelleted diets, top-dress premixes, solving problems for horses around the country. I even treated a stallion that was in Chernobyl when it blew up, when it exploded, and he was radiated and had difficulty with semen and quality, and worked with another human physician that was working on the Chernobyl victims, helping to correct this problem. And I thought, this is really challenging because we really don't have medicine for this. So I got into what we call developmental bone disease, metabolic bone disease. It takes on a whole lot of names. Going to ranches, doing, say for instance, you had a bunch of horses with fertility problems or crooked-legged foals. These are issues that I would address. I would start by doing hair analysis, because hair analysis is just like a pedal analysis in a vineyard. Mm-hmm. If you want to know how your soil is, you take a look at the leaf, analyze it, and tells you what the roots are doing, right? They're drying up. Hair analysis is the same thing. You take and you look at 40 or 50 elements, you can tell exactly many of the conditions, the elemental changes that are going on in this horse's diet. Mm-hmm. Combining that with blood chemistries, sometimes radiographs, a total history of the ranch. We would be looking at forages, analyzing those. Water, some pHs of water range from 8 on down to 6.5. So that destroys the way minerals are absorbed. So I would take all of this. At that time, as I said, I was fortunate enough to meet Dr. Enzo Stutz. We fed this into his computer software. He was a nutritionist, mainly avian, and developed top dresses, premixes we called them, to balance the ups and downs or the excesses and deficiencies of these diets. Tremendous results with that simple approach. Taking fertility, increasing it 20%, broodmares that were difficult, taking crooked-legged foals. For example, at that time, zinc and copper were big players, creating what we call metabolic bone disease. We get crooked-legged foals. To have it fixed involved periosteo stripping, very expensive, not to mention the foal sometimes didn't turn out that well. By getting these minerals correct, getting the balance of minerals, this was way back in 1973, saw a dramatic improvement in fertility in newborns. And that kept going. And then as it worked up, I did this in all countries. It ranged from China to gosh knows where, all over North America. Then in about 1999, I should say there was anecdotal research going on all the time. In other words, I would keep accurate records on fertility. Was I increasing it 10, 20%? This is all field work, not university work. As you may know, university work's very expensive. You know, you better be prepared to part with $50,000 or $100,000 if you're going to do a university research.
Research documents that there are medical benefits associated with pet ownership, like cholesterol levels, blood pressure, longevity. People that have surgery actually come out of the surgery quicker and go home faster when they have pets to go home to. Is there a correlation there?
Yes, Jewel, that's an interesting subject, of course, in animal behavior, human behavior. Companions to pets are beautiful because from a mental point, anxiety point, giving new breath, let's say, to an aged person or to a homebound person in a wheelchair, that's a gift. That's a gift. And in my experience, my personal experience, I was on the SPCA board, Santa Cruz, California, in the early 70s, for I want to say 12 to 15 years. I helped introduce a program in taking goats, gentle goats, of course, and good gentle dogs to the local rest homes. At that time, we called them rest homes, senior centers, etc. Many of these were homebound people. To walk that animal into these rooms, the smile on these senior people that were in a bed or couldn't even get out to pet a cat, unbelievable, unbelievable. I think the mental bond is so tight between animal and human. And we're pretty closely related. Yes. We're not far apart, genetically or genomically, et cetera, whatever language you want to use. But extending the life of elderly people, I think there's even data to support. Plants are living things, and I know there's been work done in senior centers or where people are dying of cancer, and they can actually reflect the plant vigor relative to a dying and a convalescing patient. And I start there because life starts there.
Yes.
And move on up the chain. Now we got mammals, now we have birds, we have fish, all tightly interrelated. We're like this, we're with animals, no question. And to extend the life of a senior person, their spirits, and there's no question in my mind that a positive attitude is a healing process and also a powerful, powerful medicinal tool. The companion dog to homebound people has always been, I think of one in particular that I used one of my products, my vet eye tabs on, which is an immune modulator which balances anxiety. This person had a companion dog. It was rewarding to me because I solved a problem that she was having with this animal. A homebound person with a companion dog is trained sometimes to recognize the doorbell, a telephone, pick up burglars, etc. Sometimes there are hearing aids. There's all types of companion dog messages that they do. This particular lady had a problem with an anxiety companion dog that the doorbell would ring, the dog would maybe urinate on the floor, or if a child came in, may turn hostile and bite the child. It was totally an emotional anxiety thing, yet it was a very valuable, several $1,000 dog. When I put it on my products, one of the immune modulators that I make called vet eye tabs, we balance cortisol, meaning we straighten out diurnal rhythm. That's morning and evening cortisol. In this case, this person was so pleased. This dog's anxiety went away, turned into a normal. She loved the dog, obviously, but she was afraid she'd have to get rid of it. This dog became normal. And I have a picture of her. She's in a wheelchair. And I remember one time on a weekend, on a Sunday, she ran out of product. She actually called me on an emergency and said, "Can you get me some product right away? Because my dog's starting to show symptoms of anxiety." And it was special to me because I knew I was helping to mend the fence that was broken between this companion animal and her disability. So, yes, double satisfaction.
Isn't that wonderful?
It was. That's why you do medicine. That's why we do this.
That's great. It really is, because one of the things I've found is that your products extend the life of the animal, and that's so important in extending the life of the human as well.
Oh, absolutely. Absolutely. As I say, mental attitude, I think, is the key to longevity. And if you're, especially a homebound person, a person that lost their car, can't drive anymore, say your license was taken away because of vision, that person, you've just suddenly taken their legs away. Yes. And then animal becomes so important. And I shouldn't always say animal. It could be a goldfish. It could be a parakeet. It could be it might be a snake, a reptile. The companionship of a living thing, priceless.
It is so important, but it's also important in extending the longevity of the pet or the animal.
Absolutely.
Because that pet, if it's more active and it has more mental exposure and activities, that dog is more well-adjusted and more marvelous. And his whole life, his attitude is better. Without
question, Jewel. In my veterinary practice, and veterinarians, not just me, everybody's trained to recognize this. The college student that goes off to school, the cat starts pulling its hair out. Anxiety.
Yes.
The divorce in the family. The dog gets depressed, doesn't eat, maybe won't even go in the same bedroom. Death in the family. As veterinarians, we can almost see a picture of the lifestyle of people when they walk in with some problems through the animal, through the eyes of the animal diagnosis.
That's
so
amazing.
that's how close they are.